All right, today I'm going to talk about how ACL surgeries are performed. What I will cover, I'm going to talk about the ACL for the people that don't know what the ACL is, the injuries and the procedures, and how this is important to society. In the first point, we're going to talk about the knee joint, which is where the ACL is. And there's four main ligaments. There's two on the side, which is the medium collateral ligament, which is right here in the left knee. The lateral collateral ligament, which is the other one. These two ligaments help the knee to be stable, make sure that it doesn't go to side. And there's two on the back of the knee, which connects the femur to the tibia, which is the PCL and the MCL, which is the one that I'm going to talk about today. I choose this particular ligament because it's the one that is the most important, and it's actually the one that gives about 90% of the stability of the knee. The injuries are really common in sports. According to emedicine.com and Wikipedia, there's about 200 injuries happen each year just in the U.S. alone. 30% of these injuries are non-athletic related. The other 70% happen in sports. Most of them injuries happen for people that play soccer or football. Usually, it's the most common injury the most common way that you can injure your ACL is by cutting. It's like a non-contact performance, which is when you are moving you're cutting, you're basically moving to another place in a quick way. You're basically, your femur and your tibia, your hip moves your femur and your tibia stays in place, which causes your femur to go the other way and your tibia stays, which causes the ACL to tear apart. You basically will feel a pop, like your knee came out of place. I know for experience because I tore my ACL. And that happens, and you will try to get up, but you won't be able to because your knee basically will give up on you because it doesn't have enough support. You basically have to get surgery if your ACL is there. So basically what they do, since ligaments don't grow back, you have to get either your new ACL from your hamstring or your patellar ligament, which is the one on top right here. They basically cut some of it and they put it through they make a hole through your tibia. I mean, they cut some of your the most common way is the hamstring graft, which they cut some of your hamstring off and they use this as a graft. Or the patellar one, which is the one right here, they cut some of your patellar ligament and they use it for the graft. What they do, they basically cut a hole in your femur right here. They cut a hole right here and they drill diagonally towards your tibia, and they do they dig another tunnel from your femur down. So it basically goes like that towards your ACL, and they make another tunnel right here towards your ACL, and that's where the new new graft is going to go. So basically right here shows how the ACL is there. What they do is they put a mechanism in there that like shaves the leftover tear that it is, and they insert the new graft through there, which it goes in right here in the middle. And this over time, what it's going to do is going to start growing another ACL around it. Since ACLs don't grow back, since ligaments don't grow back, so they have to create this graft. If you don't get this surgery, you probably won't be able to do any sport activities again, or just daily like normal tasks like walking. Your knee won't be stable, or it will give up sometimes. The important to this is it's important to know how the ACL works, because I mean everybody here has one, and also to educate people. It's important to know because I mean, like it's saying, like it's good to know how an ACL works because everybody here has one. Also, this is a new performance. People some players, they suffer these injuries, then have a second chance. So they basically will, if they get injured, they won't be able to play the sport that they used to. Also, it's helpful to society to know that this is an issue that's been happening a lot lately with athletes because they don't take care of themselves. It's really important to have a strong ACL. It's important to stretch after your workout, before your workout too. because if you don't stretch and you lift, your knee joint is going to become more stiff and your ACL is going to become weak, more weak. In the recap, I talked about what the ACL was, the injuries and the procedure, and the importance. I hope you guys learned something about the ACL, and have a strong knee.